Hi, my name is Sarah Harrington and I'm a director at Inspira. I'm joined today by Claire Donnellan, who is a consultant gastroenterologist, who's going to talk to us a little bit about her role and routes into medicine. Thanks for joining us, Claire.
Hi, thanks for having me.
Claire, can you just tell us a little bit about what it's like to be involved in medicine?
So medicine is a very, very broad specialty, and I think people certainly at A-level stage thinking about going to medicine think it's all about intelligence and A-levels and getting fantastic grades. Yes, you need to get a certain degree of good grades to enter into the course, but actually when you're doing it, it's all about people. So you need a degree of intelligence to work out what's going on with a patient and work out how to treat them best. But actually it's all about interpersonal skills. If you like people, you will be a good medic. If you are very bright and you hate people, please go and do something else because we don't want you.
That's a fairly good point, to be honest. I guess there is an awful lot of people interaction. So at what stage in your training did you have to decide to specialise in gastroenterology?
But it's slightly different now. So now what happens is that new graduates do a 2-year foundation programme and they'll do 6 lots of 4-month jobs during that period. One of those will generally be a GP slot and the others will be a mixture, but that will include a medical and a surgical specialty. So that's the first 2 years. And during that time, you're getting paid and you're learning loads of skills. You then go on to a core training program of some sort. That may be in general medicine, which is what I did. It may be general surgery. It may be pediatrics. Equally, it may be general practice, where again, you do a mixture of jobs. And during that time, you do yet more exams, which are generally fairly expensive. And you come out with your exams and an understanding of the broad specialty. And at that point, you then choose your subspecialty. So for me, it was gastroenterology. And then you start a 5-year training program in that specialty. And that enables you to gain the skills that are specific to that job. So for instance, if you're a cardiologist, you might learn how to do angiograms and put stents into people who are having an acute heart attack. If you're a chest doctor, you may put cameras down into people's lungs and take biopsies from people's chests and the lungs. For me, obviously it involved endoscopy, so learning how to put a tube into the stomach but also into the bottom.
Very nice. And Claire, there's obviously been, for obvious reasons, a huge amount of coverage about medics and working in the NHS just in recent months. And medicine is still seen as a very competitive area to get into. What advice would you give young people to help them get their applications to stand out?
I think you have to know that it's the right thing for you. So I've had an incredibly enjoyable career, but it's extremely hard work. And I think it's valuable to spend time in an area such as a care home, where you're doing a caring sort of job, you're dealing with the best and the worst of people, to understand whether this is something that you want to do lifelong. Also, if you want to help out in, say, an area with learning disability children or anything like this, to give you a really good feel for challenging situations as well as the nice fluffy bits of medicine, of which there are both to be had.
Okay, so it's not all about the qualifications, it's very much about the people skills as well.
Absolutely. So you need a certain degree of intelligence, but in my experience, the people who are super, super bright actually get frustrated because it's not pure science. There's a lot of grey areas of medicine, there's a lot of pragmatism, and using bits of knowledge that you have to work out how to manage the personality that's in front of you. And therefore, with incredibly bright people, they do get frustrated sometimes, and they're sometimes better off going into a more scientific area rather than the people area of medicine.
Okay, that's a very honest answer and I really appreciate that. But for young people who still think medicine's for them, you would consider it a rewarding career?
Absolutely, I've loved it. And I think there's a very key difference with medicine and many other jobs, both within and outside medical areas, in that as we get older, we get better at what we do, hopefully, as we gain more skills, but we carry on doing the same thing. So I'm still managing patients, but the patients I see now are a lot more complex and demanding than perhaps the patients when I started. If you do some other areas of work, you start off doing that core job and then you end up managing people. and that not actually using those core skills that first attracted you to that area of work. So I think medicine, or the doctoring side of medicine, is fairly unique in that way. And I love the fact that I still can find it a challenge when I go to work. I still learn things when I go to work. I still, get out of bed and am excited by my day, because you don't know what's going to come up that day.
Okay, that's great, Claire. I've taken up quite a lot of your time, but just before we finish, are there any other top tips that you would want to give to young people who are thinking about medicine as a career?
I think go and get some work experience as much as you can, both in something like a care home, but also in a hospital. You'll find that many hospitals have programs in place to look after their local population. So certainly I've had lots of work experience people in their year 11, after year 11, year 12, to get an idea of what it's really like at the coalface, rather than the TV programs that often give a slightly unrealistic image of what's going on.
I'm sure they do. Thanks very much for your time, Claire. That's been really helpful.
Thanks for having me.
Bye-bye.
Bye.